Plus, Maurice Cacho from CP24.com is here to take all of your calls and questions. But first, asthma, arthritis, heart disease, and migraines are all said to be affected by the weather. Now there is a Canadian website that sends out weather health alerts to prepare you for that day. Here to tell us more is Dr. John Bart, also known as the Weather Doc. Is that what people call you? Is that your nickname?
Amongst other things.
I hope all good things.
Oh, of course.
So let's talk about this website.
The website's a free service. Nobody pays for this. We only ask that you provide your postal code and your email address. And we'll warn you the day before if you've got migraine, asthma, heart disease, diabetes, or arthritis. We'll tell you that the weather is going to affect your health the next day. And the email alert that arrives in your inbox tells you, please follow your doctor's advice. So what we'd like you to do is to go to your doctor and say, this service is being offered for us. We don't pay anything for it. What can we do for it? How can we prevent all the other triggers that cause our ailment to occur? How can we prevent them coming on? For instance, if you're a mother with small children and you get migraines, it's nice to know the day before that you might be getting a migraine the next day, so you can make sure that you don't incur all the other triggers that might cause the problem. Overwork, extra stress, too much alcohol, chocolate, that kind of thing. If you eliminate those, perhaps you can avoid that extra attack that you might get.
The website is called Medicline.
That's correct.
With no E at the end.
No E.
And this is an example of what it looks like when you log in.
Yes, exactly. And you just log in and the rest follows. It's very easy. It's a simple two-step procedure. It's as easy as it can be. From the point of view of logging in, this is relatively anonymous. You could log in on behalf of a relative or yourself, and we don't want your your land address. We just want your postal code, and we want no financial details from you. So this is as anonymous as it can get, but pinpoints you exactly for your need.
And there seems to be a correlation between many ailments and the weather.
Sure. I mean, everybody knows that arthritis and migraine are affected by the weather. What they don't realize is that diabetes, heart disease, and asthma are also affected by the weather. And as more and more research comes available, it becomes clearer that there are many other diseases which are affected by the weather. And we hope to extend this service to all those other diseases over the next year or two.
And so what areas do you cover in terms of regions?
We cover the whole of Canada. We're a bilingual site. We cover continental USA, and we're adding Spanish to our service as well. We cover the United Kingdom and ERA, and we hope to be moving into Europe. We're just setting that up sometime in the next 3 or 4 months.
And the email alerts are very specific to your postal code, your region?
Absolutely. Within 30 square kilometers of the area that we harvest each time is 30 square kilometers. So it's very specific. So Toronto and Hamilton and Barrie are all different.
And so how is this different than, let's say, going to a weather network site, finding out what the weather is and sort of predicting yourself what's going to happen?
You could do that. First of all, we're much more specific than a general, it's a warm front or a cold front information. We're far more specific than that, much smaller scale and much more accurate in that sense. Secondly, we have lots of research, 25 years, 30 years, 40 years of research behind what we do to show that our index will track weather changes and health changes at the same time. We are a lot more accurate. And then we provide the information right to you. You don't have to go and do anything. It'll arrive in the afternoon or evening the day before. So we provide the service, and we hope it helps. This is a public health measure as much as anything else. The figure that always staggers me is that if everybody who'd gone to the doctor in the year 1996 had not gone one time, if they had not paid for one prescription, if they hadn't used the laboratory for one test alone, the amount of money that was saved would be the equivalent for what Canada spent on medical research that year, which is a staggering figure. So this is like all public health endeavors. That's what we are. If we can provide some help in a public health manner, that make a big difference to people on a personal basis and on a national basis.
But we should also make clear that the site does not give out medical advice.
Thank you. Exactly right. No, we don't. We ask you to arrange with your doctor what you should do when you receive the alert. There is a portion of the site which says what Dr. Bart tells his own patients. But we warn people, don't take this as what you should do. Take this information and use it as a template to discuss with your own physician. We want to make you more in tune with your physician. We want to put you closer to your physician. We want you to continue to establish that relationship which you've always had.
And also be in tuned with your body.
Absolutely.
Now, I'm fortunate enough that I don't have migraines and things like that, but what about allergies? That's something that I deal with.
Yes. We don't have statistical proof yet of the association. We have plenty of suspicion. But what we are planning to do in the next few months is make it available so that you would log in over a 6-month period, providing us with information as to when your allergies bothered you. And then we would turn around and say, at the end of 6 months, we would say, listen, we know when the weather is going to make a difference according to our Mediclime index. So the Mediclime movement takes that into account. It's just we have to get ourselves organized. We have to source the funding to make sure that we can do that. But everybody will be able, anyone who with a condition they think is a health problem and that is related to the weather, we will provide them with the means to be forewarned.
And I think education is always the key in taking care of yourself.
Yes.
So again, the website is free and people can sign up at Mediclime.com.
I look forward to your signature.
All right. Thanks for coming, Dr.
Thank you
Bart.
very much.
And remember, our homepage is interactive, so we definitely want to hear from you. Some of our lucky viewers who call, email, or message us on their mobile device with a computer question will win a great prize. Today, we are giving away a copy of Norton 360 all-in-one security software. It will protect your PC, and we will also be giving away a copy of Andy Walker's book, Windows Lockdown, A Guide to XP and Vista. So this is how you can reach us. Within the GTA, you can dial 416-872-CP24. That's 872-2724. If you're calling from outside the area, please call us toll-free at 1-888-863-CP24.